Well, hello.
Hello,
And hello, everybody. I'm Billy Crystal.
I'm Whoopi Goldberg.
And we are welcoming you to the 50th anniversary of the Venice Family Clinic.
That's right, a place we know kind of well.
Yeah. And the theme for this evening is health, justice, and action. And that's something that the Venice Family Clinic has done since its inception 50 years ago. And Whoopi and I came to the Venice Clinic on Rose Avenue back in 1986.
With Robin, because we were doing comic relief.
And it was our thrill to meet everybody there and feel the dedication that the people and the staff had, the Venice Family Clinic, for the people in the neighborhood. But now it's not just the Venice Family Clinic. They think, oh, it's in Venice. There's 14 sites.
Yeah.
14 sites that now treat 28,000 men, women, and children, regardless of their income or their health insurance or immigration. And they believe firmly, and they were pioneers in this, that healthcare is a right.
Yeah. You know, oftentimes when you talk to people about healthcare, people don't realize how hard it is, particularly if you are homeless, to get help. And you don't want to jump into the hospital. You want to be able to go someplace where people understand. You may not have all the paperwork that you're supposed to have, especially if you're living on the streets. So you can find information of how to really take care of yourself from places to find, sanitary napkins, places to find all kinds, anything that makes people's lives better. Because we always have an attitude about people who are homeless. We just think, they probably could be doing better. But, sometimes it is what it is. And all you can do is lend a hand. And for 50 years, that's what people have been doing. People have been reaching out saying, how can I help?
And the clinic also has mobile units that come on the street and deal with people right on the street, people who may not know where to go or are embarrassed about the situation, or maybe are just too sick to get to the place where they need help. And so we're honored to be a small part of the great history of the Venice Family Clinic.
Yes, I will say it is very, very nice to see that they are still there in all of the places they are in Los Angeles and still fighting the good fight. It's really, because we need it. Because, of course, homelessness, as we actually thought, the three of us, thought we were going to do the show, Comic Relief, and we put a dent in it and boom. But it didn't work that way. And here we are, still on the streets all over this country, trying to help people combat the woes of homelessness.
In the middle of a pandemic, an economic crisis, and a government that really doesn't care about them. The Venice Family Clinic has always cared about them.
Yeah. So
now,
what?
We have a great show to introduce to you, and we hope you enjoy it, and we will see you after.
Yes. You look good, by the way.
I feel good.
Yeah.
Venice Family Clinic started in 1970 because a group of people living in Venice with low incomes and no health insurance needed care. Our story has been one of continual growth. Today, the collective that is Venice Family Clinic is a group of more than 1,500 volunteers, over 400 staff. We serve more than 27,000 people.
The reason the clinic is so special is because it really looks at the whole person.
The culture and the attitude at the clinic is to translate science to practice in nanoseconds.
We have a dedicated and committed staff, and we're looking at new innovative ways to increase access, improve quality, and provide an ultimate support system for our patients.
The Venice Family Clinic is always looking for how do I help the people I serve lead better, healthier lives.
We do a full life cycle of care. Pediatric care, adult care, care to very low income families. We do home visitation, care for teens at their high schools and also at our own teen clinic, and care for the elderly. We also focus on chronic disease, diabetes, heart disease, asthma. We have a special program for people who are HIV positive called Common Ground. We also have optometry, dental, mental health, substance use treatment.
We started a food pharmacy program, really treating food as medicine and really connecting food with the disease that the patient has.
We have acupuncture and all sorts of integrated medicine to take care of pain problems.
We see more than 4,000 homeless people a year. We have street outreach teams from Malibu to Mid-City. When one of our homeless clients comes in, they're offered a shower, they're offered clean clothes, they're offered all of that before they see their medical provider.
They care about you. I was really bad off. I could hardly walk. Dr. King came with Katie, the whole crew came. They saved me.
When I was 16 years old, I started doing drugs heavy. I was diagnosed with Hep C when I was 22 years old. I got denied by insurance and I was kind of like giving up. I came here and within 8 weeks I got cured.
For at least the population that we serve, we think trauma is a common thread to many of the issues that we see.
I had trauma at 15. I was a member of the Graveyard Crips. I was just out here thugging when I got shot. 16 times hit in the back, chips my spine, but that still wasn't enough for me. A robbery that sent me to jail. Venice Family Clinic opened their doors for me when I thought every door was shut. There was this therapist, Steve, he just listened. People just need that one person in their corner to just give them that confidence, give them that love. Without Venice Family Clinic, I would be in prison or dead.
They really help transform people's lives.
We will find a way to help you.
Venice Family Clinic is vibrant.
A lifeline.
Marvelous.
Awesome.
Home, community, familia.
People.
Aloha.
Loving, caring.
Natural. Necessary.
Uplifting.
Innovative.
Indispensable.
Hi, it's Norman Lear here, and he wants desperately to congratulate the Venice Family Clinic on its 50th anniversary. 50 years. I know you're not going to believe this, but I remember it at its inception 50 years ago. Hard to believe myself, but it's been a joyous, exciting journey. And I love that their mission at this moment and asking me to do this is to encourage you to vote, and keep, for the next 50 years, the Venice Family Clinic in mind. Thanks.
January 1st, 2020, we're celebrating our 50th anniversary, and then all of a sudden, bam, the coronavirus struck.
Coronavirus shift to the United States. Low-income Americans are bearing the brunt of the coronavirus fallout.
In the 28 years that I've worked at the clinic, it's never been at this scale.
Some of my patients have gotten COVID and died.
I work with a lot of different clients. Most of them are disadvantaged, and then coronavirus happened and all of the barriers and challenges grew exponentially.
Being potentially exposed to COVID was an additional pressure. Having to go to work and coming back home with a small child was extremely difficult.
Working during a pandemic, all of us have been nervous, all of us have been scared. But, we're doing our best trying to take care of our patients.
I'm part of our emergency response team. We got together, collaborated early into the pandemic. We've all had to really redesign our roles in this.
We need to shift all of these pediatrics, adult medicine, all of that has to be moved to telephone and telehealth visits as rapidly as possible. We were asked by the county to become a testing center for the West Side for our homeless clients here. We were asked to do more street outreach because there were encampments on the West Side that were growing. We also focus on food security. We started doing some little pop-up food programs with Food Forward in the fall of 2019. Then coronavirus struck and we went to 600 every week because the Westside Food Bank started helping us. And now we're at almost 2,000 people a week that we're feeding.
We have health disparities that were there long before COVID. This has just highlighted them.
One family had 5 adults and 3 children in a 2-bedroom. So when I'm asking them to socially isolate, it's nearly impossible.
During this pandemic, we've actually really seen what the color of COVID is. We've seen inequalities across many different groups of people, specifically looking at African Americans, the Latinx community, and also Native Americans.
And then sadly, George Floyd was murdered. Especially in a place like Venice Family Clinic, it caused all of us to look within and without. In the United States of America, many of the structures we have are racist. And then the question was, what do we do next? We have to look more deeply. What is bias? What is discrimination? What is racism? We have to really look at our structures here to say what's working here and what do we need to really revise.
In order to reach health equity, you have to have anti-racism, you have to have access to care.
COVID is saying, look, regardless of your economic status, if one person has it, it can affect everyone. So it is important that we look at healthcare a little differently than we have been doing.
Here we are 50 years later in the midst of a racial and medical care injustice, and unfortunate that we're still facing the same issues.
Justice at its most elementary level means that we care for everybody in our society.
We're all in this together. And so the better we take care of everybody, the better off we all are.
"50 years. I'm thrilled to share in the festivities as Venice Family Clinic marks this milestone anniversary. Hello, I'm Angelica Houston, and as a former Venice resident, I'm very familiar with the clinic's work. The clinic has provided health and hope to so many people. It's really inspiring. I visited their flagship Rose Avenue site and seen firsthand the life-changing, life-saving impact they've had on immigrants, homeless individuals, low-income families, and children. Once you've toured the clinic, you're hooked, and you want to know how you can help these health heroes do their work. For myself and my late husband, Robert Graham, we learned we could help through the Venice Art Walk event. Robert donated art and opened his studio, and I served on the curatorial committee. And in 2000, we were honored at the clinic's Silver Circle Gala. I hope you will see the clinic in person someday if you haven't visited already. But you don't need to wait for that to have an impact. There are urgent needs that we can help right now. With more than 66,000 men, women, and children experiencing homelessness in Los Angeles alone, the homeless crisis can only be described as a humanitarian crisis, one that is taking place in the United States every single day. Venice Family Clinic was one of the first community clinics to develop a comprehensive homeless health care program. The clinic's providers have the expertise and compassion to respond to the complex health problems that are only compounded by living on the street. Often those who are unhoused face mental illness, severe emotional trauma, addiction, and major medical illnesses. Venice Family Clinic's revolutionary street medicine program helps people who are most vulnerable get access to medical care, psychiatry, mental health counseling, dental care, and other critical services. They have multiple teams that are out on the streets in LA helping to stabilize people's physical and mental health and putting them on the path to getting housed and healthy. The clinic has always been the first line of response for people in need. In order to do their work every day, the medical providers at Venice Family Clinic need your help, and I encourage you to give from your heart. Venice Family Clinic's street medicine providers are truly frontline heroes. But don't just take my word for it. See for yourself.
If someone is homeless and living on the street for a few years, they will lose 20 years of their life expectancy. And that is one of the reasons why Dr. Coley King is such a passionate advocate for our homeless clients.
Hey guys, what do we got on deck for this morning?
We have a blind guy. He's got some anxiety stuff going on.
Folks are dying of the same damn things we do. Cancer and a heart attack. They're just 30 years younger. This is not a Los Angeles issue. This is not a California issue. This is becoming an American issue.
My name's Coley King. I'm a physician at Venice Family Clinic, and I do homeless and street outreach services.
Are you having any chest pain or difficulty breathing?
No.
Okay.
Generally, our patients have been homeless for 20, 25 years. They often suffer from mental illness, either suffer from addiction or the addiction has been a result of their situation.
We work a day-to-day business, working with one person at a time, earning their trust. That's why I work here. I want to be part of their existence every day. I didn't know anything about street medicine until I got here. It's toward the people, and Venice Family Clinic serves these people that I want to be close to.
So John, I think congratulations is in order for the Venice Family Clinic.
Oh yes, that it is.
Right?
Yeah.
50 years? 50 years you guys have provided health care to people, to the most vulnerable among us, especially to children.
7,500 kids annually. That's how many kids you guys ensure have the same health care many of us take for granted.
Mm-hmm. Dedicated to kindness and compassion. The VFC's quality care includes medical, dental, and vision all in one location, so it lessens the burden on busy patients, especially essential workers.
Yeah, and the fact that VFC offers custom care, parenting, and prenatal classes and services to teenagers and everybody else in clinics located in high schools in Santa Monica, Culver City is cause for celebration in itself, and it makes me and my wife, my real wife, really proud to support the Venice Family Clinic.
Me too. You know, I've had the pleasure of handing out toys at the annual holiday event for pediatric patients, and there's nothing more gratifying than seeing the smile on their face.
Hey, did you guys start without me? I was going to do this whole thing about how the clinic before school every year they hand out backpacks and school supplies, and they give a free book with each medical visit. Oh, and I was gonna talk about the clinic teaches healthy eating and healthy cooking on a budget with their teaching kitchen. I can't believe this. You guys know that I love the Venice Family Clinic.
Just said all that. You did. You did it.
Yes, keep
rolling.
Yeah,
Are you recording?
Going.
Okay. The Venice Family Clinic. They take their name seriously. The clinic serves families and is grateful for everyone giving in support of its work on this important occasion. Just give whatever you can. Every cent, every dollar makes a difference, especially during these trying times. Now, let's watch how Venice Family Clinic has made generations of Los Angeles families happier and healthier.
Something we should all be really proud of. We have a very robust prenatal program, doing 300 deliveries a year, full scope family planning.
We're helping to provide a healthy start, and that includes all of the health care for those families going forward.
I remember coming for a visit and seeing the pediatrician's office and seeing tons of books, and I was asking, why are there so many books? They were saying, the doctor is basically prescribing books to the kids. Take all these books for your child and please read to your child. They're really thinking about your whole being, and I think that really sets them apart.
I've been a client for 5 years. In my first pregnancy, it was really stressful. I did have like a depression phase. Your hormones are all over the place. You're carrying an extra life. I actually came to Venice Family Clinic to get the counseling I needed. You realize you're not alone. The staff here is just amazing. They talked about like what to expect. They talked about breastfeeding. They helped you meditate, meeting new moms. I feel loved here. I feel cared for here.
We have a program called Children First, which is an early Head Start program. It started in the early 90s. It provides care to very low-income families who have children aged 0 to 3, prenatal and in the womb. It's really the home visitor and the family working together each week. What are your goals? What do you, mom and dad, want to be learning or doing in your lives?
They're also learning health and wellness from the start.
We did a very innovative and turned out to be impactful study that started here, showing how we could teach parents how to reduce the upward tick of weight gain.
With our teaching kitchen, we get our kids involved.
We had the kids exercise and teaching them healthy eating habits.
We have kids yoga class, which is wonderful. We have a kids dance class.
Martial arts classes.
A kids hip hop class. And then we've also done kids exercise class, which is really just getting them moving.
By educating one pediatric resident, you can actually impact the lives of 5,000 children.
Every staff that I've been in contact with for 5 years, it's the best experience I've ever had.
It doesn't get better than that.
This is the best place to get care, period.
We are so thrilled to wish Venice Family Clinic the big 5-0. Now, we've supported Venice Family Clinic's legendary annual event, Venice Art Walk, as members of their curatorial committee. And Fritz just happens to be a contributing artist.
It's true. It's so cool to be part of the Venice Art Walk artist community. Mm-hmm. I get to show alongside heroes of mine like John Baldessari and Bruce Nauman.
Mm-hmm. That's one thing we really love about Venice Family Clinic. You can use your talents to give back and see the impact you have right here in your community. And it can be a family affair.
Yeah, that's right. Mm-hmm. Venice Family Clinic can trace its roots back to being founded by volunteer physicians 50 years ago. Since then, volunteers have been the backbone of their success, whether it's providing medical care, cooking meals in their teaching kitchen, distributing food at their fresh food markets, or reading to children.
And they have so many amazing stories of people starting off as volunteers and then going on to do profoundly impactful work in their careers. And so many people that volunteer after they retire. Truly, there's a place for everyone to help at the clinic.
Of course, donations are always welcome and necessary, but we implore you to also consider to give of your time and your talent to help those in need.
Hey, Fritz, let's now take a look at the community Venice Family Clinic has created over the years. Now, we hope you'll be inspired to join like we were.
I love the mission of the clinic, which has stayed the same over the last 50 years, which is really to serve the community and to serve those who have limited access and are underserved.
I grew up in this community and nobody in my family ever had health insurance. My father was sick and my friend said, why don't you take him to the Venice Family Clinic? I was so grateful that they took care of him that I asked the clinic, can I come and help translate for other patients? I've been working with Venice Family Clinic for the past 28 years.
I'm so lucky because one of my jobs is to bring in volunteer physicians. So over 32 years, I've had the opportunity to meet thousands of volunteers. And they come here because they really care about people and they really want to give back.
It's been one of the best experiences of my lifetime, working with all these people. The only thing that matters is what can we do to help? How can we make it better? It goes beyond just the core mission. It brings in young people and have them work with us.
The community Venice Family Clinic creates really resonates with everybody from patients to staff. There's not one day where I enter inside the clinic and leave feeling just the same as when I walked in. I come out beaming and glowing of energy.
Venice Family Clinic creates a very unified community. It's in the name, it's a family.
Community is important now, and it was important 50 years ago. Dr. Rossman and Dr. Davidson founded the clinic, but they were joined by a community of people from Venice, by a community of physicians and nurses and other folks who wanted to help from the local hospitals.
Out of that grew roots across the community.
Once you come and see the clinic at work, you got it. You become one of us.
One of our volunteers, Irma Colin, put together a group of women, and she said, we need help raising money for the clinic. They thought they should involve the artists. Frank Gehry, a famous architect, was living in Venice at the time, so they approached him to help them reach out to the artists for us, and thus began Venice Art Walk.
Venice Art Walk is basically an event that brings a lot of artists together, and they do an auction that's a fundraiser for the clinic. It's way more than the auction itself. I think it's also an opportunity for people to come together and think about the clinic and think about what we can do for the community.
I salute the clinic for providing a safety net for so many people and for including the whole community, not just in the cause of healthcare, but in enjoying beautiful art and the happiness that that brings. It seems to me another part of health and wellness.
There were artists like Ed Ruscha or Jean Baldessari that have been present since the beginning, and I want to be one of those artists to look back and be like, yeah, I also donated for the last 50 years, 40 years from now.
Being part of this long tradition with all these great Venice artists.
It's quite an honor, to be asked. Artists are incredibly generous people. And if they don't have money, they have their art.
Artists came together with Irma, and year after year it would raise money, and it really put us on a solid footing. So the clinic could survive. And that really saved the clinic, frankly.
It's really a community event now that brings together about 6,000 people each year who help the Venice Family Clinic.
Venice Family Clinic has become way more than just a clinic. I think the emotional role it plays in the community is very important, and I think artists are very responsive to that.
It made me feel like I was a part of the community of Venice itself, meeting other artists. It was a crash course becoming part of the community.
Everyone is in this kind of group fight for the good cause. It's so important right now, and everyone feels it, and everyone knows it, and everyone who comes out to support and volunteer are all fighting the good fight.
So more than ever, this is the year to help Venice Family Clinic.
It'll come back to you 1,000,000 times over.
I don't think there could be a better cause.
On behalf of the entire UCLA team, we are proud to serve as the presenting sponsor of the 50th anniversary celebration of the Venice Family Clinic. We are grateful that UCLA Health can partner with you to build a critical pipeline of doctors who uniquely and empathetically provide care for the most vulnerable. We raise a virtual glass to toast the entire team at the Venice Family Clinic. You make Los Angeles a better place to call home.
Congratulations, Venice Family Clinic, on 50 wonderful years. LA Care is proud to have you as part of our network of participating providers. Thank you.
Being a single mom is definitely not easy. Your self-identity is lost. You feel the financial pressure, not knowing you will be able to provide. As a first-time mom and a single mom, being able to go to one place for my daughter and my health, it released a lot of pressure on me, and having her see the same pediatric that saw me was even better. She's getting social-emotional therapy, speech therapy, and dental care with Venice Family Clinic. When I had my daughter, I actually suffered of postpartum depression. I was unemployed, I had lost my job, and so I was desperate, looking through the couch for quarters and pennies to be able to go to the dollar store and just buy some diapers for her. Children First Early Head Start helped me tremendously, especially as a first-time mom, coming into a world that was very unknown to me. They really guided me, being able to teach and guide my daughter. Having somebody that knows exactly what my daughter needed was a huge sense of relief for me. Gabby is our home visitor. I had lost my job because I was unable to go back to work after having my daughter for health complications. And I was desperate to have income. And she connected me to resources that could provide me some form of income while I was at home with my daughter. If it wasn't for Venice Family Clinic, I think I would still be looking through my couch. And now I'm in the position where I'm able to advocate for other families that have similar situations that I had. And sorry, it was hard. But I had a dream, and an early head start said, we'll back you up. So I am where I am because I had that support.
Hey, Ray Romano here. As you've just heard, there's a story behind every person that the Venice Family Clinic can help. And you've heard about the families that the clinic can care for. And you've also heard about the families that get involved in helping the clinic, mine being one of them. My wife and I have supported the clinic for a number of years now, as well as my daughter, anything from donations to volunteering at their events. Look, if there's an issue that you're passionate about, you can help it through the clinic. Homelessness, mental health, social injustice, HIV prevention and treatment, substance recovery. You can find a cause that you care about and that you want to help at the Venice Family Clinic. So please join us in the fight to help those who need it most.
Hey everybody, it's Jason Alexander here, and I just want to send my congratulations to the Venice Family Clinic on this, their 50th anniversary. Wow. Nothing lasts 50 years anymore. I know. I invested heavily in laser discs and CD-ROMs, which will give you some insight into my investment brilliance. And if anyone would like to purchase those discs and the players they play on, both equally worthless, I will be happy to chat with you. But Venice Family Clinic is 50 years old. That is extraordinary. I would like to think that I'm some small part of that success because I am a former honoree of their Silver Circle Gala. That's right. I was honored with that award in 1998, the year that the Seinfeld show called it a wrap. 9 seasons of Seinfeld. I never got an Emmy, but damn it, they gave me a Silver Circle. So who's laughing now? Julia Louis-Dreyfus. I can't even imagine. Back in 1970, a small volunteer-run clinic in Venice that was operating after hours in a borrowed dental office would be destined to become a vitally needed resource for over 28,000 low-income and uninsured people across Los Angeles. And don't let the name Venice fool you into thinking that this organization only serves a small area. Venice Family Clinic has always gone where the need is the greatest, opening clinics within housing projects and public schools and homeless shelters, as well as freestanding clinics in Venice, Santa Monica, Culver City, Mar Vista, and Inglewood. And speaking of expansion, they've constantly expanded the definition of what a clinic is. That means at Venice Family Clinic, you'll find that to keep people healthy, someone sees a doctor. They see a mental health therapist. They see a case manager who connects them with housing and food that they need to stay healthy. They see a healthcare educator who teaches them how to exercise and manage chronic diseases. Venice Family Clinic can provide a bright and hopeful future for everyone they serve, but they can't do it without you and without me. So please give generously of your time and money. Donations, large and small, all make a difference. And to make those donations, just check out the buttons and the instructions on your screen and give as generously as you can. Thank you and congratulations, Venice Family Clinic.
50 years is a cool thing. Looking back, we've created a legacy here.
Dr. Davidson co-founded the clinic in 1970. He worked tirelessly to recruit physician volunteers and raise money.
He and our co-founder, Dr. Phil Rossman, gathered colleagues from St. John's and UCLA and created an all-volunteer operation at night in a dental clinic. People lined up around the block, and so we started.
Under his leadership, it went from a part-time night clinic to a full-time operation.
The clinic was founded as a protest of injustice. Why should some people be taken care of and other people not. Medical care, in my view, is a right that everybody should enjoy.
From there, we grew it, and we grew it carefully, and we didn't lose sight of the prize. And the prize was to provide affordable, good health care to the people who didn't have it. We started a homeless clinic, mental health treatment, domestic violence. We became a family doctor for many of the people that we took care of.
I'm proud that we as Venice Family Clinic have been able to grow.
We have currently 14 locations.
But while growing, I'm proud that we have involved and kept the legacy of many people who've been involved with us in the past and then continued to reach out to others for the future.
I'm very proud of Liz Forer, my successor.
Liz is an inspired leader. She knew exactly what to do. If you want to get the job done right, put a woman in charge, and we charged, and it was a good result.
Looking back in terms of our advocacy, those of us here and working together at the clinic did extraordinary work across our community to save the healthcare system in LA County.
Advocacy has been a very important part of the clinic. Sometimes you have to talk for the people who can't talk. So we spoke in Congress, we spoke in Sacramento.
The idea of health equity and that a community is only as healthy as their sickest member.
I came to the clinic because at the time I was not insured anymore because I had lost my job. I had the opportunity to travel to Washington, D.C. to advocate for the protection of the Affordable Care Act. We visited many congressional offices and senators, and the whole purpose of that was to impress upon them the importance of the clinic in providing care.
I was so proud of the Affordable Care Act because so many people got health care for the first time. It doesn't make sense just for the privileged who can afford it to have health care and everyone else to suffer.
The clinic right now serves about 28,000 patients, but the need is so much greater than that.
We're looking forward to say what is the next 50 years going to bring. We know we will be expanding.
We're looking to grow. There are still so many people who are not getting the care they need, and to the extent we get help going forward, we'll be able to do more of that.
The rewarding piece of it is the patients. They're strong, they're resilient, and they actually challenge us to do better in healthcare.
The money you give us goes right to helping people. It's tangible, you'll see it in action.
I hope the Venice Family Clinic is here in 50 years because I think the world needs more Venice Family Clinics.
We have a model and we know it works, and now we need it for the whole country.
I'm glad we got here 50 years later, and may we continue to do as much good as we're doing.
For all that we have been able to experience together over the years and for all we'll experience in the future, just thank you. We're a good group together.
Happy
50th.
Happy 50th.
Happy 50th.
And may you have many, many more.
And more. And many more clinics. And much more health.
And it's just beginning.
Woohoo!